Let's react to the dreadful business of balding and hair loss by the modern MBA.
Balding is a deeply personal and emotional process that 85% of men around the world will experience at some point in their lives. 70% of men will have experienced hair loss by the age of 35.
Yeah, it's super common, that's for sure.
Pattern baldness accounts for 95% of cases worldwide and is the most common form of hair loss.
Yep, and in men and in women.
The stages of male pattern baldness are noticeable and predictable. It starts with hair loss at the temples and thinning hairs at the crown.
Pointing to the frontal scalp, but they're talking about the crown. So this bottom arrow where it says thinning hairs at the crown should be more, pointed to the back of the head. This is the frontal scalp over here. And, the patterns, even though they can be predictable, they can also be unpredictable. And sometimes the androgenic alopecia can actually start later in life. And most of the time, you're actually getting that frontotemporal recession that's occurring. But there are some patterns that focus more on crown loss than actually frontal loss.
These two areas form a receding M-shaped hairline. An O-shaped bald spot at the back of the head will then follow, and together, both areas will combine into a U-shaped horseshoe balding pattern. Like Thanos, male pattern baldness is inevitable. It's a genetic condition that's passed down and typically emerges between the ages of 25 and 35. For me, I started balding in my early 20s, and it sucked. It felt bad to see my hairline recede every day in the mirror, to shed every time I washed my hair, to feel the hair at the crown of my head become thinner and...
Yeah, so I think, as I've said in prior videos, the hair loss isn't just like an aesthetic component and we start to look different and we just don't like the way we look. It's not just that. I think there's like a deeper psychological impact. I think it reminds us that we're getting older and that we're not going to be around forever and that we're not, invincible. When we're really young, that's how we feel as we move through the world. And then start to experience hair loss and it's like, whoa, like the body's actually starting to fall apart.
The Hamilton-Norwood scale is a measurement system used by doctors to classify the stages of male pattern baldness. In my early 20s, I was at a stage 2. After college, I did no favors to my hairline as a new grad.
The Norwood scale, as much as I also bring it up on this channel, and it's useful, I think, in research, in clinical practice, it's a bit less relevant. It doesn't really matter if you're a Norwood 2, 3, 5, 6, when it comes to actually planning out somebody's surgery. Everyone has a slightly different variant of the Norwood scale. I think it makes more sense to say, okay, we're going to focus on this area. Plus, not everyone understands what the scale even means. So I just find it better when talking to patients to discuss general areas of loss and what our surgical plan would be to help fill that area.
I was confronted with 3 options. 1, I could do nothing. I could see balding as a way of life and learn to live with hair loss. 2, I could actively embrace the inevitable, proactively shave my head, and go bald by choice. Or 3, I could fight back and restore my hair loss through prosthesis, medication, and/or surgery, just like Elon Musk, Gordon Ramsay.
Oh, we've covered those 2 on this channel. Make sure to check out those videos about what they've done to restore their hair.
Hair loss is a global billion-dollar market with ties not just into big pharmaceuticals, but also the medical tourism of developed countries like Turkey and South Korea. While we typically take a sideline analyst perspective on this channel,
we've done many videos about people who go to Turkey for hair transplant surgery. We haven't covered South Korea too much, but they have some wonderful clinics there as well.
In this episode, we'll navigate the business of balding, the different treatments available, and the companies behind those solutions, all through my own personal experience and transformation from medication to hair transplant at a prestigious clinic in South Korea.
Oh, look at that. So it looks like he did get a hair transplant after all.
There are only 2 proven drugs for hair loss: Finasteride and Minoxidil.
Yes.
Finasteride is a tablet that...
And we have videos on each of those medications on our channel, so make sure to check those out.
...you take every day to slow down hair loss. In its simplest abstraction, there's an enzyme in your body that converts testosterone into DHT. DHT is the hormone that directly causes hair loss. Finasteride blocks the actions of that enzyme, which then lowers your body's production of DHT and then significantly slows down the rate at which you lose hair. Fundamentally, finasteride is a preventative measure. It slows baldness, but it doesn't stop it entirely. It also doesn't restore hair that's already been lost. Finasteride was invented by the American pharmaceutical giant Merck in 1993 and to this day is the most clinically effective drug against male pattern baldness.
You can see here in the images that he's showing at 60 months or at 5 years here, there is to me some signs of restoration beyond just slowing loss. So I see that in my patients as well, that Propecia or Finasteride can restore hair to a degree, not just prevent further loss.
Finasteride is just one of many blockbuster drugs in Merck's portfolio. In 2020, Merck boasted 6 drugs that each surpassed over $1 billion in annual sales, the top 4 being Keytruda, a cancer treatment with sales of $14.3 billion. The second was Januvia, a medicine for type 2
This guy's really into the financials of everything. It's good.
$5.3 billion. The third was an HPV vaccine with $3.9 billion, and the fourth was a chickenpox vaccine with $1.9 billion in sales. These days, Finasteride is a widely available generic prescription as Merck's patent on the drug expired back in 2013. But in the 20 years from 1994 to 2013, when Merck's patent was valid, the company held a complete monopoly over hair loss medication. While Merck didn't break out product sales by medication until 2006, we can see that Finasteride sales were healthy, contributing nearly $500 million every year. Keep in mind that you have to take Finasteride every day for as long as you don't want to go bald. While you can always lower the dosage or frequency, people on Finasteride are generally on it for life.
Yeah, some of my patients who start to experience side effects will go down on the dose, so they might go to half a tablet a day, or even sometimes they'll go down on the frequency. So they might take half a tablet every other day or every third day, and still are able to manage to see some stability of their hair, but with reduced side effects.
American health insurance companies like Aetna, Cigna, and Anthem don't consider alopecia, hair loss, or male pattern baldness as a medical condition. As a result, consumers have to bear the entire cost of any medication or treatment for balding themselves.
It's very rare that the insurance companies will cover the cost of your Finasteride or Propecia. Sometimes oral Minoxidil will get covered just because they don't really realize that it's being prescribed for androgenic alopecia, but Finasteride is almost never covered.
In the mid-2000s, a 30-day supply of Finasteride cost at least $90. Nowadays, a 90-day supply of Finasteride costs me less than $30. The second reason for Finasteride's commercial underperformance, again relative to other drugs in Merck's portfolio, has to do with its troubling side effects and dark history. With lower testosterone in your body, Finasteride introduces potential side effects like decreased libido, erectile dysfunction, impotence, and male infertility.
We've covered these side effects at length in our video on Finasteride, so make sure to check that out. We also discussed post-Finasteride syndrome, which is something that's been reported online in forums, but also in some literature. Please make sure to check that out within that video.
These side effects only ever appeared in less than 4% of patients. The reality is that even 1% chance of decreased libido and impotence is still 1% too high for many men. This potential gamble on your masculinity for the sake of appearance is why Finasteride remains so controversial. There's no shortage of horror stories from men who experienced the side effects and had difficulty shaking them off even after stopping the medication.
So one thing to remember here is that there are a lot of comorbidities that people have, right? Some people are depressed. Depression's fairly common in this world, right? Not just in this country, but all around the world. Some people have issues with libido at baseline and issues with gaining a partner, and it's not always because of how they look or their hair, but different other reasons. That being said, I do think that there's probably a small percentage of people who may be affected by Finasteride in the short term and maybe in the long term if they're on it for a very long time. So it's hard to say, the truth tends to be somewhere in the middle.
So many success stories from men on Finasteride who downplay the side effects and insist that the bad experiences are exaggerations, fear-mongering, or placebo. In 2016, hundreds of men who took Finasteride filed lawsuits against Merck, alleging that the pharmaceutical giant knowingly hid these side effects to keep sales up. They accused Merck of bringing an unsafe drug to market and manipulating the trial data to downplay the risks. Merck ended up settling most of these lawsuits out of court with hush money payments of $5,000 to $10,000 while successfully sealing away all the clinical data, dispositions, and confidential information away from public records.
I mean, look, it's hard to know exactly what these big corporations are doing. You have to have some element of trust in modern medicine, but of course you also have to take it with a grain of salt and realize that at the end of the day, these big companies want to make money. So could they be covering up some data? It's possible, but then I think you also risk kind of getting into this like mindset of conspiracy theories and that we can't trust anyone, everyone's just out to get us.
When I pressed my dermatologist on the risks of finasteride, she unsurprisingly downplayed the side effects, claiming that none of her patients had ever experienced any.
Yeah, I mean, I think if you put enough people on finasteride, you're going to get some of them report back that, they had some side effects. And again, like I said earlier, either they go down on the dose or they take it less frequently, or, they just stop altogether and we look at other medical therapy options. If you just claim that you never had a patient who complained about anything, you're just not prescribing enough of it. Like you don't have enough patients with androgenic alopecia or you're not following up with your patients. But I think in a hair transplant practice like mine, we definitely see this type of side effect occurring in some of our patients, and we counsel them. If someone wants to completely stop it and consider other options, then we discuss that at length. So I think you need to keep open ears to these different types of side effects. Some doctors will downplay it because we have to go based off of the literature and the clinical experience as well. But I can tell you, prescribing finasteride almost daily to many, many patients, every day, the numbers are still low. I mean, I would say that it's very much in keeping with what the data has shown, which is about, up to 2 to up to maybe 4% risk.
In the same breath, she tried to sell me non-FDA approved natural herbal supplements that she claimed were just as effective as finasteride.
See, this is interesting. I don't think there's anything wrong with supplements or having your own branded whatever, right? But the minute you start to make claims that are not substantiated, does she have a study that shows that her supplements are the same as finasteride? Probably not.
Dermatologist shilling, her questionable morals, and Merck's unethical behavior, I eventually took the plunge on finasteride after being on the fence for weeks. My experience 4 months in on finasteride has been a net positive. My hair loss has significantly slowed.
And prior to a hair transplant, I'm always looking for stability of the hair. But also, knowing that someone who's 20 has a much higher likelihood of losing hair further than someone who's, say, 45. And so that factors into decision making around transplant surgery as well.
As an unexpected positive, I actually no longer wake up with the same aggressive energy or raging masculine temper that I used to have in my mid-20s.
That's interesting. You don't hear that too often, but that's interesting byproduct of the finasteride.
Perhaps this is placebo, but I'm tempted to chalk it up to the lower testosterone in my system. Like many others, I've experimented with reducing doses to find the right balance for myself between hair loss prevention and lower testosterone.
Exactly. I think there are many patients who fine-tune the medication for their bodies with adjusting the dose. And I think it's okay as long as you're decreasing the dose, not trying to ramp it up to potentially unsafe levels.
Another anti-balding drug is Minoxidil, or more commonly known as Rogaine. It's a medication that you apply to your scalp every day through foam and ointment in order to stimulate hair growth.
Or a pill. So a couple weeks ago, New York Times wrote about oral Minoxidil, and all of a sudden people have been messaging us and asking about it because the Times wrote about it, but it's been around for decades, and actually that's how it was first discovered, and then it was turned into a foam.
However, Minoxidil's effectiveness is modest at best. Since Minoxidil is a local treatment for your scalp, it doesn't target the hormones in your body that directly cause hair loss the same way that finasteride does. While some men opt for both finasteride and Minoxidil as a
That's true. The Minoxidil is not getting at the root cause, but it still can improve the appearance of the hair.
As a comprehensive solution to hair loss, I personally have only stuck to finasteride. My perspective is that it's easier to maintain hair than it is to regrow it. Finasteride is a guaranteed preventative measure, while Minoxidil is an inconclusive reactive measure where hair regrowth itself is not guaranteed, it takes months to see results, and is yet another drug where as soon as you stop taking it, everything goes away. Having already signed onto one lifelong drug with finasteride, I've been hesitant to add another to the list.
Keep in mind that our first line choices for medical therapy when it comes to hair restoration is a combination of finasteride and Minoxidil, both as pills. We find that it's more dependable that way, generally well tolerated, and really does give the best results across the board.
Surgery is the last treatment option and is widely considered to be the most effective, long-lasting, yet invasive and expensive solution for male pattern.
Remember, surgery is not a replacement for the medical therapy, and I think that often gets lost. I think it gets lost in some of the videos that I make. I think it gets lost in videos like this. People see it as just like an alternative, and oftentimes it's not an alternative, it's an addition to. So you've got medical therapy, and oftentimes that's combined with surgery for some patients.
Hair transplants are by definition invasive surgeries, meaning there's a puncturing of skin, open wounds, and a recovery period involved.
True.
With finasteride and minoxidil, progress is noticeable only after months of continuous use, and it comes with its aforementioned risks. In comparison, a one-time 4 to 10 hour hair transplant in exchange for a clearly defined, visible, immediate, and improved end state is a great ROI.
Whoa, hold on. It's not immediate, right? So the medication takes months to work, but the surgeries also take a long time, and I'm sure he's experienced that with his own hair transplant. It's not immediate by any means, because you get the surgery, you have to go through swelling. First of all, there's risks that go along with any surgery, and then you go through the swelling and the crusts, and then the grafts are, the shafts are falling out weeks later, and then it takes 3 to 4 months to start to see growth, and then it takes about a year plus, sometimes a year and a half, to see the full results of your hair transplant. That's definitely not immediate, but some of what he's saying about hair transplants are true, but again, you don't want to over glorify surgery either.
ROI compared to prosthesis or medication. As someone in their late 20s, I wanted to tackle my male pattern baldness as early as possible and had plenty of healthy hairs at the back of my head to donate for a transplant.
He said that nicely, in that you need to have a sufficient donor supply to be able to do the transplant, and not everyone realizes that. So people with like a really broad recipient site, but then like a super narrow, small donor site are not great candidates. Or if they have a lot of diffuse thinning throughout the donor area, not a great type of candidate for a significant hair transplant. If you're looking for like more of a little tweak, little touch up in the corners, that can sometimes be doable in those types of patients. But if you're looking for a really big procedure, if you don't have enough to borrow from, then not a good candidate.
A surgeon relocates healthy hair from the areas of your head where you have lots of it, typically the back or the sides of your head, to the areas where you don't have hair. It takes 9 to 12 months for the newly planted hair follicles to grow fully, and not every hair that's transplanted over will survive the journey.
That's true, but with modern good technique, with either FUE or FUT harvesting, you usually should be getting upwards of 95% plus of regrowth. So the majority of the hairs will make it. The question is always about the density that's created, because to do good, safe hair transplant surgery, you do leave some spacings between the different grafts, and that spacing, when it grows in, might look less dense than the original hair. So then people might opt for an additional hair transplant to increase the density. So that doesn't mean it's a failed hair transplant, it just means that you now want more density and you might be getting an additional procedure.
A hair transplant in its simplest form is a permanent rearrangement of the hair on your head. There are 2 types of hair transplants, FUE and FUT.
But remember, since most of the time it's like the frontal section that's being transplanted, since that's the most visible, the medical therapy becomes really important for the hairs further back, because you want to preserve them. Because imagine you lose all this and then you have this great hairline. Things don't look good then, right? I mean, overall.
The only difference between these two is how the hair is extracted and harvested from the donor area. FUT stands for follicular unit transportation. The surgeon cuts out an entire piece of your scalp, closes the incision with stitches, and then separates that piece of scalp
Some people use staples
into smaller pieces called grafts. Grafts contain 1 to 4 hairs, their follicles, along with the surrounding skin tissue.
This one's actually showing a 5-hair graft, which is not that common, but here it is right here.
The surgeon will then make small holes in your bald recipient areas and insert the grafts one at a time.
He's talking about the recipient area, but he's showing still the donor harvest. You can see this motorized handpiece that's going into the scalp, likely the back of the head here, and punching these little holes, and that's what gives us the grafts.
FUT is the most traditional form of hair transplant.
And then also he's talking about FUT, but he's showing FUE technique right here.
And can take 10 to 20 hours depending on the number of grafts. A single hair transplant can involve anywhere from 600 to 5,000 grafts, depending on the health of the donor area.
5,000 grafts would be some very, very big mega session requiring most likely 2 consecutive days. I mean, that is a ton of grafts to transplant in one day.
FUT results in slightly higher yield, but is overall more invasive, requires a longer recovery period, and leaves permanent scarring.
So there is definitely a linear scar that will come with an FUT procedure, and most guys these days are trying to avoid that type of scar if they ever shave their head down.
FUE is a more popular form of hair transplant as it's easier, less invasive.
It's not easier. This was popularized around 2010. It was still available before 2010, but that's when it started to gain in popularity, and definitely not easier. I would say in some ways it's harder, actually.
FUE surgeries can be completed in 4 to 8 hours with no scars or stitches involved.
False. FUE does leave circular dot scars. Oftentimes procedures take way longer than 4 hours. It can easily take 10, 12 hours to do a full case. These are challenging.
While I personally never wanted to take finasteride, the drug is required for successful, long-lasting hair transplants.
And the reason for that is what I said earlier.
Reputable clinics in the United States and Canada can cost anywhere from $10,000.
That's literally our range in the practice right now. That's kind of crazy that he put that up.
To $25,000 for a single hair transplant.
Look, the cost of living is higher. I have to pay my staff a lot of money to keep them here. You know, it's just how it goes. It's true. I mean, I understand people wanting to go outside of the United States and Canada to get their hair transplants because it's cheaper. I get all that. You know, it's fine. I'm fine with that. I'm busy enough. Those clinics are busy enough. You know, you pick and choose what feels right and what you want to have done, but that is kind of interesting. That is our current range.
While one has the freedom to stop and start medication whenever they want, hair transplants are generally one and done surgeries.
I would say most of the time it's not one and done, because if you didn't do good work, then patients will come back and say, well, or they'll go somewhere else most likely, and they'll be like,
oh, this guy did a crappy job, now I need another hair transplant because what I got didn't work.
If you do good work, they'll come back and often say, well, that was great, but now I want more grafts.
While the surgical methods and tools are consistent around the world, hair transplants are more art than science. It takes skill and experience to transplant hairs in a natural manner and construct new hairlines that align with one's forehead.
Correct. And this is why, it's not just about the per graft price, right? There's a lot of artistry that goes into this, and there's a lot of technical elements. And I would say the people who choose to pay more money are paying more money because they are paying for at least perceived quality, right? They go to a clinic that seems reputable, that produces nice results. They'd rather pay that higher amount for peace of mind and for the highest potential chance to get the best results possible, because it's surgery. So you can't just, yes, you can have multiple hair transplants, but if your first one was a complete fail, it's not great for like the overall sort of final appearance of your hair, because you may have wasted a lot of grafts with that first surgery.
As the less invasive and more cost-efficient procedure, I settled on FUE for my hair transplant and began looking overseas. Shelling out $10,000 to $25,000 upfront for a hair transplant in the United States was out of my budget. South Korea is the cosmetic surgery capital of the world. The country performs over 1 million cosmetic surgeries every year and has the highest per capita rate of cosmetic surgery in the world, with 14 out of every 1,000 Koreans going under the knife every year. The beauty ideals and standards in Korea are so high that it's normal for celebrities, singers, and other public icons to undergo multiple surgeries as early as their teenage years.
I wonder if they're just as secretive about those surgeries as celebrities are here, or if they're maybe a little bit more willing to share their experience. My guess is they still keep it on the down low, but I'm not sure.
Clinics that many locals considered to be the best in the country. One of them was Dr. Kim Kyung-bok of Moment Clinic, a celebrated surgeon who rose to local prominence after having performed successful hair transplant for celebrities. Walking through the streets of Gangnam to Moment Clinic on the day of my surgery was equally eye-opening. In just 4 blocks from the subway station, I had passed nearly 20 different plastic surgery clinics, doctor offices, and pharmacies, each with signs in Korean promoting their services and success stories to locals. Located on the 6th floor, Moment Clinic was a clean, modern, new, and sophisticated office. And as I had expected, Dr. Kim was a gracious, soft-spoken, and kind man. While he spoke very little English, he made every effort to communicate his.
I like how he hasn't really dropped his hairline here. He's kept it pretty much where there are still hairs present, which is good. I see sometimes people lowering, the hairline in young men by like an inch or two. I mean, that to me is not always the best approach, and we have a video to talk about why. So from what I'm seeing, it looks like a very nice design.
Looking back, as a very nervous American in a foreign country, I'm most grateful for Dr. Kim's empathy, as he would regularly pause to listen and hear my feedback through the translator.
Yeah, I think it's important to really take the patient's opinion and their wishes into account when you're doing this process. It's not just like what the doctor thinks, but this is what the patient's going to be living with. So this process usually takes some time in the mornings when patients come into my clinic, and it's important to take that time.
At one point, he even redrew the lines during consultation after I shared some suggestions and perspective.
Yeah, I always have alcohol wipes, plenty of them to redo the markings. We would do that routinely as we go in the morning to make sure that we're really happy with the plan. And I'll also take some feedback from my staff. I'll have multiple people come and look and see, what do you think? Because I want, other people to chime in.
Right after the consultation. As they put in the IV, I was a pretty anxious.
So what I'm seeing here on the right-hand side of the screen are the DHI type of implanter pens.
Shaking on the operating table. I'd never done any surgery like this before, and hair transplants rely on local anesthesia, so I was awake and conscious the entire.
We also offer Ambien and Valium to the majority of people, and maybe he was given something similar as like an oral sedative to help just calm the nerves, especially in the morning.
The surgery was an exercise of patience.
First 3.5 hours, we're lying face down for extraction. Exactly, it takes time to get the grafts out. And then he was lying face up for 2.5 hours for the implantation into recipient sites. Yes, it all takes time.
Lying down without moving for roughly 6 hours while he and his staff of 5 nurses operated on me.
Usually in between, we take some breaks and, go to the restroom if the patient needs. We'll break for some lunch at some point.
The whole time my face was covered with an eye mask and bandages, so at no point did I see.
So I'm looking here at the overall design of the way that the grafts were placed. This is a fairly large case. I would say that's probably between 2,000 and 2,500 grafts. I see the regularization of the hairline. When I'm looking further back at the way that the grafts are oriented, there is a little bit of a regularity, almost like rows of hair that are fairly regular across.
Extraction of my hairs took about 3.5 hours, and then planting the hairs took another 2.5 hours. For around 4,300 grafts, my total cost for this hair transplant with Dr. Kim came to $5,500, which was payable with Visa. Looking back at my progress to date through these months, while my new hair won't fully grow out for another 3 to 6 months, I've been overjoyed with the early results. My hair transplant with Dr. Kim and Moment Clinic has actually been a genuinely wonderful and life-changing experience.
That's good to hear.
I would rate wisdom teeth removal as a much more painful procedure in my book than a hair transplant.
Yeah, I mean, there definitely are, more nerve endings inside the mouth there. So for sure, that is definitely more painful than a hair transplant.
My plan is actually to go back to revisit Dr. Kim after a year for a touch-up.
You see, and that goes back to what I said previously, in that touch-ups are quite common in hair transplant surgery, and they shouldn't be seen as a failure of the initial surgery. They should be seen as just wanting to increase the density or slightly modify the design or address another area of hair loss.
Further lower my hairline once the hair follicles in my donor area fully heal.
So now he wants to go lower. So, that gets into some questions of, is that a great move? Is there good stability further back? But at the end of the day, it'll be between him and his hair surgeon to figure out.
For most men, hair transplants are a question of who rather than how, and finding a trustworthy clinic overseas is no easy task.
I think finding a trustworthy clinic anywhere is no easy task. That's just the truth of it. You have to do your research just like this gentleman did.
You can follow the same process I did. reach out over email.
Oh, sorry. I just noticed like he has some B-roll playing here. I don't know where he got this footage, but the way that they're drawing out the hairline for this gentleman, I do not like. This rounded sort of element here is not a very kind of masculine look, and it's not one that's sustainable over time.
Feeling and having hair in areas where I used to be bald is a magical feeling that's hard to put into words. And for once, I actually look like someone in their mid to late 20s, and for that, I'm thankful.
Yeah, I think it's about looking age appropriate. I think it's about gaining some confidence. I think it's about being safe about the whole process. You know, you want to make sure that at the end of it, you're not hurt. You know, maybe cosmetically you didn't get 100% of what you wanted, but at least if it's well done, safe surgery, you hopefully won't regret it. So I hope you guys enjoyed this reaction video. I hope I added some element of information beyond what this gentleman did here with Modern MBA. I think he did a very nice job of summarizing everything. It's a pretty all-encompassing type of video, the business side of it as well as the technical side of hair restoration. So yeah, check out this hair transplant playlist where we cover many topics related to hair transplant surgery.